And so at this time, we're going to get ready for our panel. So I would like to ask Nan if you would join us here, and then we'll have you come back up. Ken's going to help you. He's a gentleman.
I know you. Yeah, she looked around and waited.
Yeah, he's
to
from
see
the
where
South, but I
was.
wasn't sure about him. And Dr. Evans, I'm going to ask you to come up now, and then Anna certainly can talk more about you, but I want to take time to introduce her, and she can talk about the panel. But our partnership with the Men's Health Network has been growing over the years, and we do this summit in partnership with them, and we're happy to have their support in this conference in so many ways. Anna is going to moderate our panel, and I'll just give you a little bit about her. And I've been working with her for a couple of years, but we'll see if I decided to pronounce her name correctly, because I call her Anna all the time. I've never really talked about her last name, and so I have a choice, 2 ways of pronouncing it, so I'm going to choose, and let's see if I did it right. But Anna Fadich? Fadich, I was close. Anna Fadich. You know people for a long time and never know their full name, so I'll pronounce it anyway. But I'm happy that she's moderating our panel. But she serves as the Vice President of the Men's Health Network here in DC, and her work involves the implementation of various programs and services related to outreach, promotion, health education to men and boys and their family. And she has an extensive experience, and you can certainly look her up. But we're happy that she's moderating our panel, and she'll kind of explain what she's going to do. And I've asked Dr. Evans to come up just to make it convenient for everyone to be here, but I'll let her introduce everyone and start with him. Is that all right? So let's give her a hand as she comes to moderate to this panel.
Hi, everyone. Good afternoon. Again, my name is Anna Fadich, and I've been with Men's Health Network for about 7 years now this summer, doing a lot of programming and evaluation, material development. So we are out in the communities doing all that we can for advancing men's health, in particular around the areas of fatherhood, which is why we're here today, and working with the National Healthy Start. I would like to have Dr. Jeff Evans introduce himself. We've worked with him for many, many years. So he's been doing a lot of research on policy and men's health and fatherhood. So Jeff, if you want to come up and talk about a little bit of the work that you've done, or you can do it from there. It's completely up to you.
Can you hear me here? Well, I'm an old timer, and I've been involved in fatherhood research from the beginning. And I remember in the early days, we could fit the entire field on one half of one table. And when I look at this conference and look at all of you, I am really, really gratified. And I want to thank Deborah Fraser for, really hanging in there and building something that's worthwhile. In the early days, we wouldn't have thought it possible, but what you've done here is remarkable. So, thank you. It's now that I'm retired from NIH, I do things only for love, and one of the things I love is working with the Men's Health Network, and I'm sort of a scientific advisor with them, and happy to do that. I also do some lobbying for various associations, and curious enough, I spent last Thursday drifting around the offices of key senators and congressmen who are on our appropriations committee, and that was an interesting experience. I think we've got some really interesting times ahead of us. But not to worry. There is lots of interesting things to sustain us, although we have to be kind of agile and continue to grow. That's who I am and what I've been doing with myself since I retired from NIH a few years ago.
Great. Well, thank you so much. So we're going to, we had these great presentations today, so we're just going to have an open dialogue. So I will start off some of these questions, and if anyone has any questions for any of the panelists, please feel free just to raise your hand and we'll get you a mic. We'll start off, I would like to ask each of you to tell me from your perspective and your work, what have you seen has changed over the past 20 years in fatherhood and men's involvement within parenting and fatherhood? So we can start here with Nan.
Well, I think fatherhood has become more important. I think that in the research community, which is the community I know best, people are more interested in it. As I indicated in my talk, I think there are some groups that they're not especially interested in, and that could bear improvement. But I would say in general, and I think that the instigation of responsible fatherhood programs happens in the last 20 years, and I think that that's been a positive development. So.
I haven't been in the field for quite 20 years, but given my knowledge of the literature, yeah, I would say that even in the past 5 years, there have been an explosion of studies focusing on fathers. My knowledge is more in the developmental field, so why fathers matter for kids. And if you read meta-analyses, which try to look at everything out there and look at overall trends, there might be a handful of studies from the 80s or 90s, and then more from the early 2000s, and then 10 or 15 from the last 10 years. So it seems like they're garnering more attention, and there's a little bit more attention paid to specific subgroups that we need to know more about, which is always good.
From a longer-term perspective, I remember a long time ago, Linda Waite and Francis Goldscheider wrote a book called New Families or No Families. And it was somewhat of a challenge to men in that she said, or that they said, either men change or we're going to stop having families and reproducing. That's it. I guess they were right in a way. I've seen men evolve quite a bit. Men are changing, and they're learning to deal with all sorts of really interesting and complicated arrangements in the household. So, watching this evolution, this social evolution of fatherhood, is really really interesting to me. And it's happened in a very relatively short period of time.
I know just recently the new administration has developed some plans and ideas for having parental leave, which is a huge change in terms. The conversation was always about maternal leave and paid maternal leave for newborn babies, and now they're talking about parental leave. So do you think that we're going to start seeing more companies implementing father's leave? Maybe not at the same length of time that a mother would need to heal and bond with the baby, but do you think that this is going in the right direction, that the administration is going to be able to implement this?
I guess my short answer to that is no. I'm not sure that, I'm not sure that there's a really groundswell of support. I might be wrong about that, but I hope I'm wrong about that. In terms of parental leave, I'll just say briefly that the truly politically correct way to say this is dependent care leave. Like, I worked for a long time with people who did the demography of aging, and they pointed out that people need leave to care for elderly parents as well. So the experience of other countries, I guess, is really instructive here. And I know that in Scandinavia, they have very generous parental leave policies, and I think it was in the 90s, maybe it was a little earlier than that, that they started making men eligible to take it. So there was like a total of a year, and they made it possible that a man could take it father could take it if he wanted. And my understanding, and anyone here who knows better can correct me if I'm wrong, was that men didn't take it. Until they changed it to you had 9 months if only the woman took it, and you had the full year if you got that extra quarter year if the father took it and not if he didn't. At which point men's behavior really changed because everyone wanted the parental leave. And I think there have been some studies looking at that, whether it changed father involvement and what have you. But in the United States, I'm still very skeptical.
Yeah, I guess I would like to be optimistic about this. I think we definitely need parental leave more so than maternity leave, but there needs to be other incentives to kind of encourage fathers to take it. If the prevailing message is still that they are the economic support of their children, then they might think it's worth staying at work and not being home to be involved, especially, infants are largely sleeping and eating, so they might feel that their time is better spent caring for their family if they stay at work. I've also read in the literature that Nan is talking about that there can still be a disadvantage to the workers for taking this leave. So if fathers perceive that, if it's not kind of at like a larger, if there doesn't feel to be a cultural shift in the organizations that are offering this leave, they might not feel that they can actually take it without repercussions to their career. So, I mean, I know that women are also dealing with that, but I guess it seems like it would be difficult to see a real change without those kind of larger systemic changes.
I'm more optimistic. I think we can have it. And I think you're actually going to see some very interesting politics. There are issues on which the new president has much more in common with Democrats than Republicans. And yet he can bring some Republicans along with him. On this question of parental leave, and including dads as well, I think this is one of those kind of classes of issues that you might see some surprising developments. I know from a traditional standpoint, when you look around Washington politics, you would say, nah, it won't happen. But something tells me that we're getting into an age where a lot of surprising things are going to happen. And so, I would urge you to keep your agility and accept the improbable as possible now.
Yes, you have a question?
I had a question about this leave issue. It seems like that in order for you to have the kind of leave that you're talking about, you have to be employed first. And I think there is a class issue that's running through this question, because at the same time, we're building a public policy where the social safety net is being tattered in a way that's requiring certain groups to work for those benefits and to not be home with their kids. So can somebody reconcile that for me? Because I'm having dissonance. So I was just wondering if you had any thoughts about that. The panel had any thoughts about that?
I do. And you're right. I mean, right from the beginning, the fatherhood area has been demarcated by people who have wealth and jobs and people who do not. And it's a slightly different set of issues. However, don't undersell the low-income population. They have jobs, and in many of those jobs, it is possible to work out an arrangement where dad and mom can spend some time together. And considering that even marginalized young men of color even though they may not have a lot of money, and even though they may not have a lot of education, they do have relatively conservative aspirations. It may not be realized because of barriers, but who knows? A policy like this, if we finagle it right, if we adjust it here, add an incentive, a support, it's very malleable at this point. It may actually help some of these young dads work out a reasonable relationship with mom and better bond with their children. And wouldn't that be a nice thing to happen?
Some of my colleagues at the Urban Institute have been doing some work on non-standard work hours. And one of their findings was that one of the ways they studied women, because they were concerned about childcare, and so, I mean, they study women. They shouldn't just study women. But one of their findings was that women with non-standard work hours depended upon the other parent more for childcare than women with standard work hours. And so I think that, I mean, the problem with non-standard work hours is that you can't tell a babysitter when they're going to need to work, and so they become non-standard too, I guess. And so it looks as though the other parent becomes more involved at that point. And again, I mean, I don't want to suggest that non-standard work hours is a great thing, but it might have an unintended positive consequence of fathers being more involved.
This is something that, that I've thought about a lot recently with, so we have the FMLA right now, but it's unpaid, and just, it seems impossible for middle-class parents to take leave, so I can't even imagine what low-income parents are going through with the cost of childcare, the cost of hospital bills after the delivery, all this stuff, and then to say that your job is secure but you can't be paid while you're home recovering or whatever, it just seems impossible. So I think that it's definitely something that these leave policies need to take into account, and I don't know enough about the policies in Scandinavia to know if it's, if it comes from the employer or if it comes from the government and kind of everyone gets it. But yeah, I think that that's a really good point, that having leave doesn't necessarily even mean that people will feel that they can take it if they're not getting paid 100%, or if it might mean that they don't have a job when they get back, or they're not put up for promotion later, or things like that.
I think at least giving that opportunity for people to be able to take that, it hasn't been on the table in the past. So now if there's an opportunity, look, you can take parental leave, paternity leave, maternity leave. I think that at least there's the option there, and then what the employer would be able to work out with you. We had another question up front.
I'm curious as to, I'll reframe it. When I worked at the health department in maternity and family planning clinics, I had, as a social worker, I had clients, pregnant women, to come in and their husbands or significant others with them, but were often discouraged from being involved with their, with the pregnancy, or what was going on with their wife or significant other. When we started Healthy Start back in 1990, the early years, one of the main things we talked about was the need to involve fathers and within the entire care piece. And so the grantees sought ways in which to have the fathers involved. The primary issue was funding opportunities. I think Nan touched on it when she was talking. And I guess I hear all of the different points that have been made, But Dr. Evans, I believe, is the one who hinted at it the most, but it seems as if the issue is around policy and policy development and how, and funding streams. You cannot be funded for working with men. You have to work with women. We talk about maternity-centric, I think was the term, whatever the term was you used, Nan, I believe. But oftentimes that was a systemic impact as a result of funding streams. And so I'm interested or curious in hearing your perspective as to how potential, the results of the research that that Nan shared today and Elizabeth, and your experience at NIH, Dr. Evans, how do you get the policy relaxed to address these issues? Because I think people working within the community, working within the field, get it, of the need to work, but because of the funding restrictions, that drives how a person provides services. So I'd like to hear each of your perspective.
Well, when I answered the question before, I said two things. I said practices are important. And I think that they are. And so it's good to hear that folks on the ground understand to bring fathers in and might do some things like change the posters in their place to bring fathers in. But you're right. I mean, until systemically we regard children as needing something from their father besides his money. And I'm not sure, I'm not sure I know how to do that. It's kind of like, I don't know. I'm not sure I know how to do that. Except maybe, I think Ronald Reagan said an anecdote is worth, tons of data. Maybe we all have to really talk about our dads. I'm sorry I'm not answering your question. I'm as frustrated as you are. You're right. Changing the posters on the wall is nice, but until you have money to deal with dad and his issues, it doesn't mean much.
If I could just chip in. Remember, I cautioned to be keep your agility, right? We've always been agile, and that's why when people got interested in the family, we came up with healthy marriage, right? So look at what the current policy environment is going to focus on. I said on Thursday, I spent all day with Republicans, all right? What are they thinking about? They're thinking about more state and local control, right? What do you want to bet that sooner or later you're going to see a lot of health dollars in the hands of state and local officials rather than federal officials? That's certainly something that's on their mind. Now, do you know a group who is strong at the local level? Well, I think I'm looking at them. You guys are both federal, but you have a strong local component. You got stuff that you can build on. You know how to do it. What are Republicans also interested in? Well, intergenerational poverty, reentry of prisoners to local communities. You have people who are very upset about the opioid epidemic, which of course varies a lot by local areas. You might see state and local officials try to use different kinds of platforms to address all of these kinds of issues. And I think it may it may turn out that health-related platforms are strongest. And you've got such a platform. Now, whether you want to look around and take on issues like this, I don't know. But they all involve men. And they're all important. And so, you know, with a little agility, a little good humor, you might just be able to find that you could resurrect a considerable funding stream at the state and local level.
In the fall, I would have said that I thought that we were getting a lot more funding for this type of work. It seemed like there were changes to the child support policy that were announced in December that weren't perfect, but seemed to be moving toward kind of recognizing the need for involvement beyond the economic for dads and kind of tying that into child support. As Jeff said, though, I have no idea how to predict what changes are coming now, though. But I think that I've seen some positive changes. It just seems very slow. And I also don't have a very good answer for how to get us there, except that you know, some of the other research that we've alluded to, the work in Scandinavia and Frank Goldscheider's work, really emphasizes the need for fathers to kind of re-enter the family as an equal partner, and then society as a whole will benefit. So if women are also in the workforce, dads need to also be in the family. And hopefully with the data that we're seeing from other countries and work that you guys are doing and work that we're doing, maybe that message will kind of get out there eventually.
Yes.
I got a question in the back, please.
Oh, okay.
I hear a lot of questions and answers on policies, and I'm trying to understand because nobody addressed the situation that a system is designed to keep the parents and the kids separated, as such as child support. When you have a parent, the mother, that says that the father is providing for the kid, but they're not together, so she wants certain kind of government help, and those agencies tell her, well, we can't help you unless you put that father on child support. He's taking care of his kid. So now you have created a situation in that household, and the peoples that come together, like we all in here today, very important people who have great ideas. When the policy is being wrote, these people are only called after the policies have been decided. Why they're not coming to the table before all these policies have been decided and give their opinion and some input, and maybe we'll have better answers to what's going on, because we are dealing with the individuals that's having these problems. The policymakers setting up high. We're in a fold with these people.
So I think it's important, anytime something new comes out, there's always question of, you know, how is this going to affect me? How's it going to affect my community, the people that I work with? So what's important is getting all of the folks that think the same way at the table to make public comments and statements. You know, it doesn't matter the health issue. It could be something around, you know, screenings for prostate cancer. When you have a certain belief, you need to get out there and make the statement known. You don't know how many other people are sitting there thinking the same thing and maybe just don't feel like they have the voice. But I think one person standing up and saying something empowers the next person, which empowers the next person. And so then you start getting a whole network of people that are saying things. So writing to public officials, writing op-ed pieces and papers, you know, making comments online that are going to be productive to what we want to see come forward. Is there another question?
Yes.
Thank you. I'm one of those that has to catch a plane. I have to leave before our session is over. And so I want to make a comment and then a question. First of all, this has been a tremendous conference. I have enjoyed it thoroughly. It's my first time here. But my name is Ben, and it rhymes with Ken. That's all I'm going to say about that. So my comment is there's some things that we haven't talked about. And so it's my opportunity to give a very short impromptu evaluation, as great as this conference is. We haven't talked about marriage. We haven't talked about boys becoming men specifically, and what that entails and how that looks like, because boys shouldn't be having babies, men should. And grown men that are authentic respect women and honor women. We haven't talked about that necessarily. We haven't talked about discipline, and we haven't talked about how to, I shouldn't say how to, we haven't talked about some things very specifically that are on the table of developing the whole family. Because if you have a messed up man, he messes everything up. Messes his job up, he messes relationships up. But if you have a real man, he even will become a better employee where he works. And that is worth funding, the development of the man. Okay, so that's my comment. So my question is, how do we, or what does your research show in relationship to the authentic manhood to fatherhood piece? What does your research show that it's better to train a boy to be a man rather than to rebuild one? Which is a famous quote from Frederick Douglass, by the way. Thank you.
I think that kind of goes along with what I was going to ask next as well, because Dr. Karberg, you had talked about father presence, and one of the things that Men's Health Network does is we have this a series of Hill briefings on fatherhood presence and boys' health and boys turning into men, so elementary school and high school. So it really starts within the home, and that first few formative years of a child's life, getting him to where he needs to be. So learning the correct lifestyle and methods. If you want to talk about that, and then the other folks can also answer.
Sure. My research focus is on early childhood. So I know that from what I've studied and what I've read, fathers are really formative for social and language development in particular, but other aspects of child development. And when they're positively involved, whether or not they live with their kids or not, their kids do better socially, which matters for how they respond in their relationships down the road, how they respond academically down the road. It's just kind of pervasively an important skill to have. But they also matter. Nan's point about the differences in book reading by resident and non-resident dads is really important, because dads can be so influential for kind of little niches of development, like language. Like, they tend to talk to kids like they're real people, adults, and not use motherese, which is important because it challenges kids and it helps them develop language better. So there are a lot of ways where dads can be really influential for that. I focus on early childhood because I love this idea of kind of getting kids before there are problems, but I know from people who do adolescent research, some of Nan's students, in fact, that they think that there's just as much promise kind of intervening later in life, and that you're not a lost cause just because you had a bad childhood or that you've had adverse experiences leading up to a certain point. So maybe she can speak a little bit more to that.
I want two reactions. One, I'm glad that my students continue to proselytize what I taught them. That's excellent news. I guess that the most tactful way I have of saying we need to intervene across the lifespan is you cannot regard putting a lot of dollars or a lot of time into early childhood development, which is all you seem to hear now, you can't regard it as an inoculation. It's not like the measles vaccine, where you give the kid the measles vaccine once and they'll never get the measles. Early childhood intervention and early childhood development is incredibly important, but if you stop there, the child is not immunized against whatever negative forces that child might be up against. And you need to continue intervening across the lifespan. So I feel very passionately about that, and I'm delighted to hear that my students who work at Child Trends are. I guess the other thing that I would say is that there is insufficient attention being focused, in my judgment, on the vulnerability of boys in our school system. I mean, it starts, a piece of that vulnerability is things that have come up at this conference. A piece of that vulnerability is differential discipline within our school system, which gets boys out of the mainstream and starts at a remarkably early age. So that's one piece of it. Another piece that came up this morning is the very strong possibility, supported I think by some developmental research, that boys and girls are on a different timetable and that maybe boys would do better if they entered kindergarten at age 6. And that's not because there's anything wrong with them, it's because that's their developmental trajectory. But I think that the degree to which girls are doing better than boys in school is a tremendous problem facing us, and it needs to be taken really, really seriously. And it starts in pre-K and it goes right through college. And it's not, in my view, the majority of Americans do not even know that girls are doing better in school than boys. I think they would, if you ask the average person on the street, they would assume that boys were doing better.
I'd like to just weigh in. In the early days of fatherhood research, Natasha Karberg was my postdoc. She was AAAS postdoc, and we used to have wonderful arguments about what fathers really do, and especially low-income fathers. And I emphasized that fathers do things that are unique that mothers can't do. And of course, mothers do some things that are unique that fathers can't do. And the deal was to try to have a deal to figure out who does what. Her point of view is that, well, modern men and women are doing more or less the same thing. And so her idea of a modern dad would be someone that is pretty much a mom. Now, 20 years, 25 years have come and gone. And how does the state of the literature go? Well, I mean, Natasha just published a review article with a bunch of other people, and essentially said, well, it's a little bit of both. But I think that my part of the argument, that is that men do something unique, is largely unappreciated, mainly because we never developed the measurement scheme necessary to do it. And why do we do that? Well, what measurement scheme do we use? We used Michael Lamb's measurement scheme, and he's a developmental psychologist. And where did he get that measurement scheme? He watched mothers dealing with their children, and then he modified it to think about, well, how dads might fill in around that and do the same thing. And Natasha was very, very active in getting that measurement scheme in the surveys that we all use. So that's our data. It was all flashed up here. I guarantee you, it all used the same measurement scheme, Michael Lamb's. It's all been modified a little bit here or there, but it's basically Michael's. And it's basically essentially expecting to find that dads do more or less the same kind of things that moms do. Maybe a little bit better, maybe a little bit worse, But it's not surprising to find that we don't know about things that dads do totally unique from mom, especially in older ages. That's still an uncharted territory and unappreciated territory about men. Because I think in the issue of how do you get children, both men and women, to grow up into being productive economic agents, my gut feeling has always been that dads have a real important role in that. And but we've only got anecdotal evidence. We don't have real scientific evidence because we don't have a real scientific measurement scheme on that.
I guess before I didn't really address your point about the lack of talk around boys generally. And so I just wanted to point out too that Natasha was part of a big research effort under the My Brother's Keeper initiative to study or boys of color. So there were like a couple of special themed meetings of developmental conferences and kind of reports and briefs and research efforts that happened fairly recently that I think isn't really out there that much yet. But Nan's point that the average person probably doesn't know that boys are doing worse in school than girls, that kind of evidence coming out more in this kind of very recent research that I hope will kind of pick up a little bit more, that people will take note of it a little bit more. So I think that you're right, and research is finally kind of showing your point. So hopefully policymakers and others who are seeing it every day will kind of see that reflected, and then there might be more funding opportunities or other things to help you address that.
I think we need to wrap it up. Please join me in thanking our panel. If anyone has any questions for them, please feel free to ask them after the session. And I want to bring up the two Kens to close us out. Thank you.
All right, the panel, you can stay up there. So, and I apologize that we're cutting it off, but this is fascinating, and it's actually opening up a lot more to kind of start something new. We don't want to go down that road just yet.
Absolutely.
Because, Ken, I think what we want to do is shake up, wake up, and then break up.
Absolutely.
So we're about
that's
to
it.
wrap up for you today, but we want you to shake up a little bit in your seat because you've been sitting and a lot of information's been going on. And when you shake up, then we hope you wake up. And then we just want to do a couple of things to finalize so then we can break up. Now, how many have had a breakup in your life?
That you're publicly willing to raise your
Not
hands
me.
for.
I've been married for 27 years. I courted for 6, and we have not broken up yet. Now she can't break up with me. So a couple of things we want to do, and again, let's thank our panelists again. And go ahead. And so they've really had a lot of conversation, and you all have been engaged in your questions as well around research, policy, and practice, which is, and those that have come to this conference before, we like to wrap up this conference focusing on that. And so they've done a fantastic job with that. But we also like to take advantage of the opportunity of having you all here and being present with us to gather information from you around research, policy, and practice. And so we're going to do that with a fast round. How many want to play a game to end? Fast round. And so basically, Ken and I will ask you a couple of questions, right, Ken? Just
Yes,
a couple?
just a couple.
A couple of questions,
Yes.
just to gather some more information out of you that we can take information back with us, because we work for a woman that works us very hard, and that is Deborah Frazier. And so we
Deborah.
always have follow-up work to do. And so we try to do a good job for our national office and our terrific CEO there around this work. And so we do this work not in isolation, but with you. The conference that folks have commented that was fantastic for you, it's based on the feedback you give us each and every year. And so this is an important part of what we do is closing this summit. So I just need an agreement by a show of hands. How many are going to join us in fast round?
3?
Now I'm going to try that again, because they don't raise their hand. They can get up and break up right now. We trust that you're going to do that. Ken, is it me or you started the question?
I think you're up first.
Well, I think, so we think about research, policy, and practice. My question was, of the 3, and you can shout these answers out, of the 3, just from your perspective, research, policy, and practice, of those three, which do you think, based on what you've heard over the last couple of days and with the work that you do, which of the three are the most important to focus on? And we'll hear different answers because it gives you an idea of who's in the room. Shout it out. Policy. Policy. Policy.
Policy.
Policy.
Practice.
Policy. Practice. Policy. Practice over here. Policy. Okay? This sounds like we should probably do hands because this is pretty varied. All those that think policy we should focus on. Okay? Look around the room we ask. And those, huh?
Practice should inform policy.
Okay. Okay. And so Ira Chasnoff, his point was practice should inform policy. How many agree with that? Raise your hand.
Okay.
Okay. All right. And how many of those thought that we should be focusing on practice? Because we had a couple of comments. Okay. And then research.
That's right. Research.
Research to inform policy. Okay. So that gives you a temperature in the room. I think that's good information to go off of. What do you have, sir?
All right. So mine is around one commercial break is Dr. Karberg has got articles out, so they're out on the research table. So please make sure you grab one of those on your way out. So we forgot to mention that earlier. So mine is, what is the biggest barrier for fathers and men in those three areas? Policy, research, and practice. What is the greatest barrier? Greatest barrier. How many of you say policy?
Again, a barrier for these men involved.
All right, policy, okay. How many of you would say research? Maybe, none. All right, and how about practice? Practice is a barrier, okay? Well, good. Obviously, we see there that there's some policy issues and some policy work that has to happen, yet that we may not know for sure how to do that, but I think we can focus on some of that.
Yeah. So we're seeing where we need to spend our time moving ahead.
Absolutely.
It sounds like a lot around policy, and then hearing the comments about policy. So I think our agenda is being set before us.
You have one more?
I think I have one more,
Okay.
Ken. I think I need to get this out. I can't go back home without getting this out.
Okay.
And that's recognizing the diversity of folks that come to our conference. And so I think of the individuals that are here and some fantastic individuals. We've heard some and fantastic individuals in their presentations, but many of you who are not on program are sitting out there and you're doing this work at various levels. And so what we'd like them to think about, Ken, is the work that you do from your perspective right now. And we need to know among our family, Healthy Start family and community, where do you invest your time within those three areas? So it's, again, know those who labor among you. So we want to know among you all, where are you spending most of your time right now? How many are spending your time in research? Okay? And we'll ask the panelists, because it's important that we know who works on. So if we need to connect with folks that are doing research, who's spending their time in research? Okay? So you all look at these folks around. Some of you've heard ask questions, but others that you don't know, connect with if you're interested in research. These are some folks that are part of this community. What about policy? How many of you invest your time in policy work? Okay? And I know some of you out there, and so this experience spans over 40 years. Mm-hmm. I can tell some of the people that have been doing this work, so you want to connect with those resources. What about practice? Who's out there working directly with these men? Look at in families. Okay? Very important to see.
Okay.
Okay? So I think those are things that are very important. So we have a surprise for these folks. They're getting out of here early.
Absolutely.
Yeah, so we're breaking up early. How many are down with that? Oh, maybe they want to say, you and I will leave. They can stay. How many are down with ending early today? Great, so we're almost done. So you've helped us think about research, practice, and policy in various ways, from your conversations with our panelists, as well as what you've engaged with us just these last few minutes. But a couple of things we want to do, and Deborah has given us the opportunity to do this, and that really is to thank everyone. And I love for Deborah to come up, because number one, I think she's absolutely beautiful, and you need to see her, but she always says, you all do it, and so she makes us do this. And so we'll do the thank yous, and I'll save her thank you for last. And this, and I'm going to do an all but one, Ken. And everyone in this place right now has the ability to stand but one person. So when it's time to thank Deborah, I'm hoping that everybody
will stand?
Except one.
Okay.
Yeah, and that's one person who has a knee injury that she's been dealing with. But she's our friend. We've set up her.
But I think she's going to stand today.
Oh, she might.
Oh, yeah.
For Deborah, you might want to stand up. I'll stand for Deborah on a broken leg. All right, so I'll call out some names, and then we'll just, you all just join us in clapping and thanking these folks. But you know, today was Sunday, and I didn't go to church. But I felt like there was a reverend in the house that took us to church.
Yes, sir.
Let's give it up for Reverend Evans, who said, keep your joy. That's the message. Give him a hand. I like that. And this work, and we think of the conference, I think of all the work we've been doing behind the scenes, all the work of our partners and the work of our projects across the country. It's been a hard year, and people are really scared in this time of uncertainty. We have to keep hope. And so that message of keep our joy from someone who's lived and learned and experienced. So we received that from you. So with that as the theme, we're going to keep our joy and thanking these wonderful people. So we had lots of help. First of all, give it up for my other Ken, who helped coordinate and do a lot of things this weekend. Thank you, sir. You still got it.
Yeah, well, and I'm going to kick it back to you in terms of my Ken, who is bold, obviously bolder than I am. Is that salmon or is that?
Salmon.
Salmon.
Not salmon, but salmon.
There's salmon. Y'all give it up for salmon.
And that guy that helped us on the mic, and we watched him develop and grow as a male coordinator.
Absolutely.
He's dressing sharp these days.
Yes.
He's one of the team.
And slimming
Tony
down.
Jaliffe, where is he?
Tony.
Where's Tony, all right?
left.
Give him a hand anyway.
That's
he was
right.
helping on the mic. Yeah, he wore his nice clothes and
He
stuff.
missed his 2 seconds of fame.
And he'll never get it again.
Never.
It's on video. There you go. And what about the Tulsa team? And Karina's not here, but there she is. Had a back to me. You have your back to me? She has a back to us? Come on now. But Karina and her Tulsa team has really helped do a lot of different aspects of this conference this weekend. Oh, this is a good one. You're right. Can you sing? No, I know you too well. No, you can't. That's why he's not been in the choir for the last 4 years. But we have our choir director for our Healthy Start, National Healthy Start Association choir director, Benita. Give her a hand over there. So we're going to get down this year as well. And we had a great volunteer. Deborah had some help in the office, and we want to shout out for Brandy. And she's been helping everyone. So let's give her a hand. And when you go by the registration table, make sure you thank her. Along with Brandy, there's B. Haskins that is there. And B has been with Healthy Start since the beginning. So let's give it up for B as well. All of the staff are great, but we have some special folks that have been here for as long as we have. So we've developed a relationship with many of the staff personally over about 18 years or so. And we have our new relationship with our youngest dad. Did you know Lamont? You know he's a father, right? So Lamont's over there, man. He made sure he was here with us. Wow. Lamont, stand up.
That's right.
This baby's 2 years old this year. He made it his priority to be with us, Healthy Start. Once he found out that we were here, he had moved on, but he came back to be with us. I think that's a sign of the dads, and many of those that work with dads, you know, when you make a connection, they will come back.
Yes.
All right, so we're glad that you're with us. All of our speakers, one more time, these folks that were with us yesterday, let's give everyone a hand again. And how many think Anna did an outstanding job?
Anna.
So thank you. And she's like family, so you're thanking family, but we still should thank family, don't you think?
Should thank family.
Yeah, and so her, Jimmy, and everyone at Men's Health Network, our partners, we thank you as well. And then there's 2 other gentlemen I want to thank that did our fatherhood panel on, that did the fatherhood panel yesterday, Ken. And there's some pretty snazzy guys, and for us, because you're getting old, sir.
And you're getting older.
Ken decided to become a father again at age 55. No. He has a 3-year-old now. After having, I won't go into it. But,
don't go into it.
Yeah, he's insane, but you look okay. But we'll keep our eye on you. But this is like the new generation. Ken and I love what we do, but we are always interested in getting the next generation of folks in our Healthy Start family. And again, these men, we have some outstanding men across the country, but these are some that are really rising up and taking on leadership. And so they did our fatherhood panel on yesterday. And we want you to recognize who they are, because we're also from the association's office establishing a fatherhood Google group for all of our Healthy Start coordinators to kind of have a central place to talk, network, etc. And these gentlemen are going to lead that for us when we set that up. But let's give it up for Richard DeRosa, Boston, Keston Jones, New York, and Rodney Moore, New Haven. Okay? So those are the guys you can kind of connect with, and at the association office, we'll be establishing this Google group for the fathers, and these guys are going to help do that, and they want to do a rotating leadership, and so Richard can tell you all about that if you talk with him, but they're going to do the lead for a year and groom others to kind of take it over to share the leadership. So it's a wonderful opportunity for folks to stay connected. All right, I think I'm almost at the end of my list of thank yous. Oh, the big one. Okay, and we cannot thank this woman enough. And so please, let's really thank Deborah Frazier, our CEO, who's the vision behind all that we do. And we're the men doing work, but really, Deborah is an awesome visionary, and I love working with you personally. Professionally, I love working. She's one that will not only stimulate you, but motivate you. And certainly the times that I've been discouraged in pulling all this together, Deborah's the one that keeps me encouraged. And so we talk almost every other day. We're talking in all times of the night. And I just really appreciate her being here at the helm, because there's no one that I can think that would be able to do what we've done in the last few years, especially, other than Deborah Frazier. So please,
Right,
let's
let's
thank
give it
Deborah
up.
Frazier.
Give it
All
up.
but one. Oh, everyone's up, even the one person.
Thank you, guys. Jeff, when have you ever been called a reverend? Never? I want to thank all of you and thank Men's Health Network for being wonderful partners. And I guess maybe 3.5 years ago, I called Jimmy and I said, we've been talking around the Men's Health Network roundtable about what to do. And he had speakers at the table who were like, well, you know, we can't do much more with fatherhood because we need more research. And then he convened just a research panel. And I kept saying to Jeff, what are they talking about? You need more research. We have all this research. And all of our fatherhood program managers know what fathers need. Why don't we just do it? And Jeff was like, I don't know. Maybe they just think the research is old. And so finally, I called Jimmy and I said, Jimmy, let's just do it. So we just met in the corner at Union Station, Jimmy and Jeff. And he called Ben, and Ben joined us, and we planned the first conference. And we said, we'll just do it really small, see how it goes, and we'll go from there. You just have to just do it when it needs to be done. And so thank all of you for supporting us just doing it and moving forward. And I appreciate you being here. I appreciate the partnership with Men's Health Network. And these two Kens should have their own show. It's a total pleasure to work with them. And we just love that you've come back and joined us again this year. And thank you to Beatty for coming out of Brooklyn, leaving New York, texting, emailing, and staying in touch. Thank you for being here with us. And thank all of you for being here these last 2 days.
And lastly, I get another hand for Deborah. Thank you. So Ken, the last note to end with is an appropriate note when we talk about hope, joy, and what we need to motivate us as we leave here and head off to our week of wonderful conference for our spring annual conference. I think it's important to talk about these folks and thank them for being here as well.
Absolutely.
So we've had many of folks that are actually doing the program, working with families, and families come to this conference. And so we certainly wanted to acknowledge and remind you of why we do this work and the importance of doing it and doing it well. You may not always have all the answers, but I think if you bring your full self to the work, whatever you've been called to do and whatever space you've been called to occupy, I think you'll do okay when you keep this as your vision. And so I'll ask these people to stand so we can also acknowledge them, because they are some of the most important people in the room. And this year, our youngest summit attendee's name is Caleb at 6 months. And so I would like to introduce the fathers from Boston program. Tremaine is the father, Marika, the mother, and Caleb, our youngest summit attendee 2017.
Woo!
Boston. So this is Richard DeRosa's program and those guys. Did you all get stuck in the airport? Yeah. Oh, wow, what a story. Yeah, what happened? Yeah, we think, yeah. So we heard, and during your trip, they had horrible travel, and they got stuck in an airport overnight with the baby. Is that correct? But they made their way here. They came. They was tired and exhausted. But did you enjoy yourself? Well, we're glad that you're here. So.
Absolutely.
They got a meal when they got here.
And did you get a good meal when you got here? Yeah. So, courtesy of the Hyatt. So the Hyatt heard the story and they took care of this family.
All right.
You're in a good space and place. Let's thank them again.
Now, y'all don't go out there telling no false stories trying
And
to get a
Ken,
deal.
let's thank everyone for being here again. You all have a great event for next week, and those that are going home have safe travels back. And
Absolutely.
thank you all again.